Okay, to assess your patient's first cranial nerve, the olfactory nerve, you take a substance, a familiar substance, and you have your patient occlude one nostril, so occlude a nostril for me, and it's similar to the red cap test. You have them smell. So that's $100 of cinnamon. Close up your other nose and on nostril. Do those smell the same to you? Same strength?
Yes.
Awesome. So you know that her cranial nerve 1 is working. Then you move on to cranial nerve 2, the optic nerve. You take your patient's visual acuity, so you have them cover up one eye, and you look out at the chart out there, and can you read the lowest line you can for me, please?
OHPNTZ.
Perfect. And switch up eyes for me. Same thing.
OHPNTZ.
And with both eyes.
OHPNTZ.
Perfect. So she got 2015 of DOSOU, and you can repeat the same thing at near if you deemed it necessary. The next thing you can do is concentration visual fields to assess their field range. So you'll have them cover up their eye again. You have them look right at your eye and tell me how many fingers you see.
2, 1, 5, 1.
Great. And switch eyes for me. Look at this eye now.
1, 2, 5, 1.
Perfect. And the next thing you want to assess is their color vision, so you do a red cap test. So you have them cover up one eye, and you have them look at the red cap. This is $100 of red right here. Okay, cover up your other eye. How much would you pay for this much red?
$100.
So you can see there that she saw the same saturation of color in both of her eyes, so there's no problems with her color vision. So the final way that you can assess your patient's cranial nerve 2 function is by doing direct ophthalmoscopy, so directly looking at their nerve. So to do this, you'll have your patient look straight ahead, put the ophthalmoscopy up to their eye. It's going to be a little bit bright. And so you assess their nerve. Her nerve looks round, pink, and distinct. I don't see any pathology or anything concerning, and you do the same thing on her other eye. Another thing that you need to do when assessing the optic nerve is check the pupil reaction. Now, for the purpose of this video, I'm going to leave the light up, but in a normal setting, you would want to turn the lights down so you can make sure that you had the full constriction. So what you're going to have your patient to do is to look out at the target on the screen. So look out there for me, and first you check their direct response, looking for constriction of that eye that you're shining the light into on both eyes. And then you look for consensual response, so you shine the light in one eye, look for constriction in the other. And then the last thing you'll do is the afferent pupillary test. So you are swinging flashlight test. Looking at there, it's going to get very bright. Checking to make sure that the pupils stay constricted. Alright, looks great. I don't see any APD or any other defect. So we're going to move on to cranial nerve 3 and 4. Actually, both of them you need to test extraocular motilities. So you're going to have the patient take off their glasses if they have them. So you see this light right here? Alright, what I want you to do is to follow this light using only your eyes, and I want you to tell me if you ever see any double vision or if you have any pain, okay? So you do your physiological age, keeping the light on the patient's face.
Next thing you would do would be to test facial sensations. So you would touch the patient's forehead, cheek, and jaw.
And then the last thing you do, just because it's easy to do at the end of this, is to bring it in, follow my light in. Good. Check your patient's accommodation. Does that hurt at all? Did you ever see double? Yep. Good. So you know that their patient's ocular motor, trochlear, and abducens nerves are working well. That's 3, 4, and 6. To assess the functionality of cranial nerve 5, the trigeminal nerve, we're going to do a couple of different things. The first thing we're going to do is test the motor part. So I'm going to have my patient clench her teeth really hard, and I'm going to palpate on both sides to make sure that her face feels evenly clenched, which it does. Great. The next thing we're going to do is test the sensory part. So I'm going to test all 3 branches, and I'm going to use a safety pin and a cotton swab and have her tell me if she thinks that it's sharp or dull. You ready? Look straight ahead for me. Is this a sharp or dull sensation?
You can also frown.
Really? I don't know. That's okay. Keep looking forward. Same thing, sharp or dull?
Oh, sharp.
Okay, there we go. Same thing, sharp or
Let's do
dull?
a cranial nerve
Dull.
reflex. So, but we've already
Down here?
One other thing we can do is
Dull.
get her to puff her cheeks
What about
out
now?
and make sure that she's
Sharp.
all this good.
And here?
Sharp.
Excellent. Excellent. So you would do both things, all things on both sides. Maybe educating your patient a little bit better about what is sharp and what is dull. The last thing we're going to test is our patient's corneal sensitivity. So we have here a sterile cotton swab, and we're just going to have the patient look straight forward. And we're going to gently touch her cornea. And you see she blinks pretty intensely with both eyes, so we can be sure that her corneal sensitivity is intact. You would also repeat that on the other side. So the next nerve that we're going to look at is cranial nerve 7. It's the facial nerve. So what we're going to have the patient do is I'm going to have her clench her eyelids really tightly together for me, and I'm going to try to pry them open. As you can see, there's quite a bit of resistance there, and you would do that on both sides just to make sure that they were equal and definitely resistant. The next thing you want to do is make sure their face is symmetrical. So you'll have your patient do a big smile, and you can see her face is symmetrical, big frown. She's very sad and symmetrical here, and now I'm going to have her puff out her cheeks for me and try to hold it in while I push, and you can see that there's definitely some resistance there, but she does have an equal resistance in both cheeks. The next nerve we're going to go into is the cranial nerve 8, vestibular-cochlear, and for that you're going to have your patient look forward, and you're going to start off by moving your fingers together quietly and then increase the volume, and tell me when you can hear my fingers moving, okay? Good. And so you would do that on both sides and make sure they are about equal. The next thing you're going to do is called the Weber test. So you're going to hit your tuning fork, place on the vertex of the scalp. Do you hear that evenly in between your two ears?
Yes.
Good. So the last thing you have to do with cranial nerve 8 is the Ryan test. So you hit your tuning fork, place it behind the patient's ear until they can't hear it anymore.
No.
You put it in front of the ear. Can you hear it there?
I can.
Excellent, that's good. The conduction in air should be greater than bone. The next nerve we're going to test is cranial nerve 9, the glossopharyngeal nerve. So what we're going to do is just to check for hoarseness in our patient's voice. So I'm going to have her repeat after me, say the sky is blue.
The sky is blue.
So you can tell that her voice doesn't sound hoarse, so she's probably doing great on that nerve. The next nerve we're going to test is cranial nerve 9, cranial nerve 10, that was cranial nerve 9, excuse me, the vagus nerve. So what we would do for this is we would get a trash can, and we would have the patient lean over the trash can and gag themselves, just to make sure their gag reflex is still intact. We're not going to do that today because we don't want to make her throw up in lab. But the next thing you would do is you would have them open their mouth really wide, and you would shine a light in there, and say, put your tongue down for me, and say, ah.
Ah.
And you can see, probably not in the video, but I could see that her uvea was straight and it didn't deviate right or left, which indicates that there is no weakness on either side. The next nerve we're going to look at is cranial nerve 11, the accessory nerve. And so what we're going to, what we're going to do for that is I'm going to put my hands on the patient's shoulders. I'm going to push down and have you shrug up for me. Good. And so you can see that she's able to get past the resistance of my hand. The next thing we're going to do is have her turn her head to one side, and I'm going to put my hand right here, and I'm going to have her try to turn her head to the middle, and you can tell that she's pushing really hard, and you would do that on the other side as well. The last nerve is cranial nerve 12, and that is the hypoglossal nerve. And so what you're going to do for that is have your patient move their tongue inside their cheeks while you put your hand on there, and you can see on both sides that I can feel her tongue resisting against my hand, so that indicates that there's no weakness on either side.